Welcome to Medicine Information Factory YouTube channel. Today we shall discuss about Vonoprazan. What is Vonoprazan? Vonoprazan is a medication used to reduce stomach acid. It belongs to a newer class of drug called potassium-competitive acid blockers, which work differently from traditional acid-reducing drugs like proton pump inhibitor. What it is used for? Vonoprazan is commonly prescribed to treat gastroesophageal reflux disease, peptic ulcer disease, Helicobacter pylori infection. How it works? Unlike PPIs such as omeprazole, Vonoprazan blocks an acid production more directly and rapidly, does not require activation in an acidic environment, provides longer lasting acid suppression. Key advantages: faster onset of action than PPIs, more consistent acid control, may be more effective in some people who don't respond well to standard treatments. Side effects: common side effects are usually mild and may include diarrhea or constipation, nausea, headache. Serious side effects are uncommon but can occur especially with long-term use. Bottom line, Vonoprazan is a new potent acid suppressing drug that's increasingly used as an alternative to traditional PPIs, especially for GERD, ulcer and H. pylori treatment. Uses in pregnancy and lactation. Use of Vonoprazan in pregnancy. There is limited human safety data on Vonoprazan used during pregnancy. Animal studies have not shown major birth defects at usual exposure levels, but high doses showed some fatal effects. Because of insufficient human evidence, Vonoprazan is generally used in pregnancy only if the potential benefits outweighs the possible risk. For pregnant patients with acid reflux or ulcers, doctors often prefer medication with longer safety experience such as famotidine, omeprazole. Use drugs lactation like breastfeeding. It is not clearly known whether Vonoprazan passes into human breast milk. Animal studies suggest that the drug may be excreted into milk. Because the effects on a breastfeed infant are uncertain, caution is advised during breastfeeding. A healthcare professional may recommend an alternative medicine with better established safety data or decide whether breastfeeding or treatment should be temporarily interrupted depending on the clinical situation. Important advice: pregnant or breastfeeding patients should avoid self-medicating with Vonoprazan and should use it only under medical supervision. Contraindications: Vonoprazan should not be used in the following situations: hypersensitivity or allergy to Vonoprazan or any component of the formulation. Concomitant use with certain drugs that strongly depend on stomach acidity for absorption, where reduced acid can significantly decrease effectiveness. Severe liver impairment. Caution is required because the drug is metabolized in the liver and exposure may increase in severe hepatic disease. Important precautions: Vonoprazan should be used carefully in patients with suspected or confirmed gastric cancer. Long-term acid suppression risk factors such as vitamin B12 deficiency, low magnesium levels, osteoporosis-related fractures, significant liver disease. Drug interaction. Vonoprazan may interact with the medications metabolized through liver enzymes including some antifungals, antiretrovirals, anticoagulants. A healthcare provider should review all medicines before starting therapy.